Hello viewers, welcome back to my channel. In today's video, we are diving into the one of the most essential SDTM domain used in the oncology studies, that is the TU domain, which stands for tumor lesion identification. Whether you are a beginner in clinical SAS programmer or preparing for an interview, this video will give you a solid understanding of how the domain works. So let's get started. The TU domain stands for tumor identification and is part of the tumor domains in oncology trials in SDTM. The TU domain represents data that uniquely identifies tumor lesions or location of interest. Commonly, tumor lesions and location of interest are identified by an investigator or an assessor and are classified according to the disease assessment criteria. While creating a record in TU domain, we should have a unique tumor ID value, the anatomical location of the tumor, the method used to identify the tumor, role of the individual who is identifying the tumor, and the timing information. The structure of this domain is one record per identified tumor per subject per accessor. The topic variable is TU test CD. The required variables are the study ID, domain, use subject ID, TU sequence, TU test CD, and the TU test. There are expected variables such as the TU link ID, which is the value where you capture the unique tumor ID. Then the TU result, captured result, the standard result. Then we have the location and the method where the tumor was identified and by the which method it was identified. Then we have the last observation before exposure flag. Then we have the evaluator, visit num, and the TU-DTC variables as the expected variables. There are a long list of permissible variables, out of which few are mentioned here, which are the TU group ID, ref ID, speed ID, link group ID, the TU NAM, TU LAT, TU DIR, and so on. Now let's understand few of the important concepts for the oncology studies. In oncology studies, unlike studies in other therapeutic areas, only patients diagnosed with the specific disease under investigation are enrolled in the trial. As a result, all screening assessments that identify any tumor or lesions are treated as baseline assessments. During the course of the trial, these patients may develop new tumor or exhibit changes in the previously identified ones. Any assessments conducted after the baselines are referred to as the post-baseline assessments. Now let's explore how the tumor identification domain captures information about these tumors. The first one is if in the post-baseline assessments, a new tumor or lesions may emerge, then what will happen? Then in this scenario, a new post-baseline record will be created in the TU domain to represent the identification of this new tumor or lesions. A new link ID will be provided for this newly identified tumor as well. The next is if the existing one, which was initially identified at the baseline, is subsequently splitting into separate distinct tumor or lesions, then in this case, there will be additional post-baseline records which will be created in the TU domain. But to identify that these newly split tumors or lesions are a result of an initially existing one which was identified at the baseline, we will create the link ID in such a way that it will let us know that the what will be the baseline link ID. To explain further on this concept, I will take up another example in later in this video. So next is the case where two tumors get merged to create one large tumor. So in this case, again, the link ID will be the source of information to identify that which two existing or the initially identified tumors has been merged to one particular to create one large tumors in this scenario. In oncology settings, when a new tumor is identified, a record must be included in both the TU and TR domain. However, The TU record may contain different level of details depending upon the data collection methods employed. For example, that the first scenario is that when the occurrence of a new tumor or lesions is the sole information which is being captured, then in this scenario, we will have only one record in TU and one record in TR. In TU, we can create a record where the TU test can be tumor identification, where and the TU ORRES can be the value of new because it is a newly identified tumor. We will also provide a link ID for this tumor, and we will link this tumor using this link ID in the TR domain, and we will create a record in TR dataset by the TR test CD as tumor state and the TR ORRES as present. Please note that in this scenario, this is the only information a sponsor might need. Why? Because an occurrence of a new tumor is a sign of disease progression. The second scenario is that along with the information of a new tumor, we are also capturing the anatomical location of that newly identified tumor or lesion. In that case, in TU dataset, for the created record, we will also have the information populated for TU LOC, which is TU location. Another point to note here is that since we are already relating this record, the record in TU with the record in TR using the link ID, and we are already populating the TU LOC variable mentioning the anatomical location, we do not need to populate the TR location for this record because we can always find out the location by linking back to the TU record. The third way is that along with the occurrence of a new tumor and along with the information of anatomical location, we are also having the information of measurement of this particular tumor. In that scenario, in TR domain, we will capture the records of the measurement or assessment of this particular tumor. And just to give a brief account on what type of measurement we can have for this tumor is we can identify the diameter of the tumors, the long diameter, short diameter, and so on. So all these type of information will be created in the TR domain and will be mapped to TU record using the TU link ID. Now let's see a standard eCRF provided by this CDISC. So right now I'm showing you the standard eCRF format which is being provided by CDISC, and you can see here that how the TU or the TR information can be captured on the CRF form. You can note that first of all, the first question is that were any tumor identified? So that is a header question, you can say, and based on the response of yes or no, the rest of the information will be captured. The next information will be the tumor ID, which is the link ID, which we will use throughout the tumor domains, the TU, TR, and possibly RS as well. So this is an important information which is being captured in this particular CRF form. The next is the location and the other directionality information of the tumor which is being identified. We are also having the question for the method of evaluation. Please note that the method of evaluation information, this is a procedure, you can say, which we have done to assess the identification of tumor. So any method of evaluation record can be created in the PR domain, and the PR and the TU domain can further be linked together using the rubric here. In other words, say suppose a particular tumor was identified using the CT scan. So in this scenario, there will be a procedure record in PR domain that the subject has undergone a CT scan, and we will have the information of date, which is the date of evaluation, and all that stuff we have in our PR domain, and we can relate this record in PR with our record in TU, where the TU method will have the information of CT scan, and we can create a rubric for this particular relationship. So in this way, you can see that further information which we can capture on the TUTR CRF form is the information about the evaluator. And in case if we are having the evaluator information, we will have the evaluator ID information also captured. And as we have discussed that in case we are also capturing the measurement of the tumor, and in this case we are having the questions for the longest diameters in the CRF form, that information will be mapped to the TR domain and will be linked to TI using the link ID. Now let's see one of the TU example dataset. In the shown dataset, please note that the first 4 records, these are the records which for a single subject, and it was the record where the radiologist 1 has identified 4 target tumors in the lung of the subject. Since these were the target tumors, the link ID has been provided in such a format that the T part of the link ID is helping or is being used to identify that this is a target tumor. If you will notice that the next 2 records, which are for the non-target tumors, that were also identified in the screening visit, but since these were non-target tumors, the link ID is having the initials of NT being used to differentiate these 2 non-target tumors with the target one. So please note that there is no hard and fast rule to populate the link ID in any particular convention, but it is always suggested that the link ID should be populated in such a format that you are able to identify few informations about the target which is being talked about. So in this case, for the target tumors, we normally use T as a prefix, and for non-target, we use the NT as a prefix, followed by the number of starting from 0, 1. The next records which are highlighted in yellow, that are important to note here. Let's talk about the first 2 highlighted records. If you will notice that the TU link ID for these 2 records are mentioned as TO0, T04.1, T04.2, and in the test code you can see these are mentioned as a tumor split. So we to identify again now that if these are the split tumors, which tumor was split, because in the screening visit we have identified 6 tumors, and now these records which we are talking about, these are the records which is happening from the visit week 16 assessment. So what has happened is that for this subject, the tumor which was identified in the screening visit has been split into 2 tumors in the week 16 assessment. To identify which tumor was split, the link ID plays an important role. You will notice here the initial 3 characters of the link ID, which is T04, is giving an information that this particular tumors which is being split as 1 and 2 are the tumors which are created from the tumor which was marked as T04. So in other words, the tumor which was identified in the screening visit and was given a link ID of T04 was later on split into 2 tumors and was given a link ID of T04.1, T04.2. So this is a good way of giving the link ID, which will help to identify which initially identified tumors has been split into multiple tumors. Similarly, if you see the third highlighted record, here also the link ID is providing a clear information that which 2 tumors has been merged together in week 24 assessment, and we have created a test code for these 2 as the tumor merge as the test value. So in this example, the tumor T02 and T03, which was identified in screening visit, has been merged together during the week 24 assessment, and we are creating a one record for this particular tumor, which is having the link ID as T02 and /T03. Another point to notice here is the last record, the week 32 assessment record. Here in this particular assessment, there was a new tumor identified. So since it was a new tumor which was not initially present at the baseline visit, which is the screening visit in case of TU, we have given the link ID as new01, and we have created a new record with the information of tumor identification test and result as new. So in this way, you can capture the information of the tumors identified during the study for a subject and create a TU record, and the TU link ID is being used to relate all these identified tumors with the TR domain, which is the tumor results, where we capture the further assessment results for these particular tumors. Now let's go through some of the common interview questions related to TU domain. The first one is, what is the purpose of TU domain in SDTM? So to answer it in an interview as an interview question, we can mention that the TU domain is used to identify all lesions or tumors present in a subject at baseline in oncology clinical trials. It provides unique IDs, locations, and types that are the target or non-target for each lesions that will be tracked throughout the study. This baseline identification is critical for linking to subsequent measurements in the TR and the RS domain. The next is, what is TU link ID and why it is important. The TU link ID is tumor link identifier. It is the unique ID assigned to each lesions per subject. This variable is crucial because it acts as a bridge between the TU and TR domains, enabling consistent tracking of lesion measurement and the responses over time. The next is, what is the relationship between TU, TR, and RS domain. The TU domain is the domain which identifies the lesions at baseline, whereas the TR records the tumor measurement over time. The RS is the domain which captures the overall tumor response, such as complete response, partial response, based on the specific criteria, for example, the RECIST criteria. All these are linked using the TU link ID, enabling a consistent mapping of tumor status across the study. The next one is, can one lesion have multiple entries in the TU domain? The answer to this question is no. Each lesion should have only one record in the TU domain per subject per assessor. That record will have a unique TU link ID. Any changes or updates related to that lesion, such as its size or response, are captured in the TR and RS domain, not by repeating the TU record. Let's wrap up what we have learned today. The TU domain plays a crucial role in oncology studies by establishing a baseline inventory of tumor solutions. Each lesion is uniquely identified using the TU link ID, which connects in the subsequent measurement in the TR domain and response evaluation in the RS domain. Remember, TU is about what and where the tumors are, not how they change. Those changes are tracked later in the TR and RS domain. If you are working on RECIST-based study, getting comfortable with TU is a must. That's all for today. If this video helped you to clarify the TU domain, please give it a thumbs up, subscribe for more SDTM content, and tap the bell icon so that you don't miss any upcoming videos on the TU or on the TR and RS domain. Please drop your questions or suggestions in the comment.
and let me know if you want me to cover any specific topic. Thanks for